Welcome to Zimpapers Television Network, and you are tuned into Diplomatic Passport. This is the COVID-19 show that gives you updates, national statistics, Zimbabwe's state of national preparedness, and the general response to the coronavirus pandemic in Zimbabwe, the region, and beyond. I'm Robert Mkondiwa. Today we woke up to grim news yet again. A third person, patient 9, has died owing to coronavirus-related complications, bringing to 3 Zimbabwe's mortality figures, according to a letter with today's update that we woke up to. I've always and had always posed this question. Fine, our cases of active COVID may be stable, but if we have no one in Wilkins, why should they be isolated at home and not be at Wilkins? The argument that the cases are stable and do not need hospitalization has now started to be chipped away as being frivolous and excuse. And why are they active cases at home? It is angering and dismaying, and certainly faith in the home-based monitoring approach, which was low in any case, has now not only hit rock bottom, but certainly started to dig. If you thought I started on grim news, you haven't heard the least of it. The government of Zimbabwe, as I speculated yesterday, has confirmed our worst fears that there indeed is no guarantee that this lockdown will be lifted when the 21-day initial period that they announced lapses. The tragedy is, lockdown is supposed to be used for testing, increased purposes in order to arrest the spread and contain the virus. Instead, a precious chance is being let to slip. The nation has not been testing well, and our rates of testing leave a lot to be desired. Indeed, Director of Health in the city of Harare, Prosper Chonzi, has been bemoaning the same. Nobody's listening and certainly nobody's acting. We await the results of the tenders to procure necessities that the government said they were going to, that they put out last Friday to come out, so that we can see whether we can start to regain that trust that the nation shall indeed scale up testing. If you don't test, you don't know, and not knowing is ignorance. However, with regards to that bit of news that we may not be seeing the end of lockdown, that is something that came from the Presidium today. Let's watch what they had to say.
Question of lockdowns, we are at different levels of imposition of lockdown in the region. I cannot tell you whether at the end of 21 days we shall lift the lockdown. I only appeal that all of us observe the lockdown, observe the measures, comply. That way we save lives.
That is grim news indeed. A lot of you are tired of sitting and waiting for the end of this period of lockdown in your homes, and to be told that this may go on for a bit more, well, that must be depressing. However, good news coming our way is that Zimbabwe has received some important equipment in the response to coronavirus. CAPS Holdings, ICAD, Hujuan from China, and the University of Zimbabwe, amongst other players, have donated ventilators, tents, thermometers, hand sanitizers, hydrogen peroxide, face masks, overshoes, biohazard kits, test kits, amongst a host of a lot of other things. Hopefully they will be able to account for the real progress in the response to COVID-19 in Zimbabwe. However, what we want to be sure of is whether this can be used and professionals are capacitated enough to use the ventilators and other equipment that is coming in. Now, to help us interrogate that and also shed light on reporting this virus in Zimbabwe is the evergreen Takudzwa Chambake, who has been at the forefront of asking crucial questions that you have been posing whenever he goes for those daily briefings at State House. In fact, straight after this, he's going to be headed to State House, and he's our frontline reporter. Taku, welcome to the program, and it must be a very hectic something, breaking new ground and, of course, reporting COVID-19.
Most definitely. Thank you for taking me in studio today.
Well, I understand earlier on you were at a press conference at State House, hey? And what was the key highlight of that briefing?
Well, it wasn't a press conference in essence. It was the president and some members of the task force meeting various players from the private sector and, intellectuals in different respects. So we had your doctors represented, we had your nurses represented, lawyers also there, architects and engineers, players from the media fraternity. Our own CEO, Mr. Deketeke, was also present at that meeting. So they were discussing on various issues regards people who are exposed to issues to do with the coronavirus, talking about your medical practitioners, talk about your media. Lawyers were coming in with issues to do with the law, how it's going to be applied. You know that the police are taking extreme action on people just loitering, and they were just speaking also from legal perspective, how those things can be handled. You know right now that the Ministry of Local Government has highlighted that they will be drilling a lot of boreholes. Some engineers, they were also highlighting their concerns to say the more we keep drilling without planning, we should not be shocked in future if we wake up and we no longer have enough water supplies, because if we keep drilling and drilling without really assessing what we're doing, this will affect us in the long run. So these are some of the issues that were coming up today.
And it's feasibility, isn't it? Because we seem to be reactive, and the more you're acting from a reactive position, you're going to do something very haphazard. And the thing is, we're just drilling boreholes, and we're very happy that there are 10 boreholes being drilled there and there are 15 over there. But as you're saying, if we don't do a correct feasibility planning and so forth, we're doomed.
Yes. That's one of the issues that players from the private sector are also raising, to say, let this be a learning curve. Whilst this pandemic is something that we don't want, it's also revealed a lot of things, and the president also admitted to the fact that he didn't know that there was such expertise in the country, and he was actually saying, henceforth, they'll start looking from within before they start engaging players from outside Zimbabwe, to say, let's find homegrown solutions to our challenges, and from this point going forward, let our health facilities be made robust enough to handle anything that may come up in the near future.
Absolutely. And you've been asking a lot of very clever questions, and I'm going to come to that a bit later on. But for example, in the case of Zororo Makamba, who passed away, who was the first casualty of COVID-19 here in Zimbabwe, his family had said that there was some bit of neglect and a fear of catching the virus from the medical professionals, and that they neglected him out of that, and he died a very miserable young man. Was this raised during this briefing? Did doctors, for example, raise this? Because it was pretty damning on them.
Well, let me take you back to before the lockdown actually came through. We visited Parenyatwa, and what we were hearing from some of the health practitioners there was the fact that people were taking leave because they didn't want to be involved in the process. They were not trained. They were not aware of how to protect themselves. They didn't have protective PPE, protective clothing, and it came up today. Dr. Samkange from the Zimbabwe Medical Association was speaking into these issues to say people had to treat patients who were then later confirmed to have the coronavirus, and unfortunately some of these patients went on and they passed away.
And you're a man of record, and I'm sure you've got a record of this. So perhaps let's watch that bit and see what the doctors had what the doctor had to say, and perhaps interrogate that and see if they've got a case.
Sure.
Recently at Parenyatwa Hospital, we had a patient who came in as a multiple trauma. They needed surgery, but they also had all the symptoms that go with COVID. Frontline staff from anesthetists to surgeons were scared of touching the patient. But while they were waiting for the result, which took more than 24 hours, the patient's condition was deteriorating. We need to avoid that situation where frontline staff cannot make a decision because they don't know the result.
Frontline staff being scared and not making a decision because they didn't have all the information. And I'm pretty sure we've seen people work in furnaces or with furnaces. If you're properly equipped, you can do almost everything. And I think that's one of the things that they were talking about here.
Yes. We've toured mines where, a wall can collapse anytime, but there are measures that have been put in place. There's high attention paid to making sure that people follow said procedure. And this is exactly what the doctors are crying out for, to say when a patient comes in, there should be a process to say, let's test them. That's why they've actually been calling for rapid testing kits to come through. Fortunately, Dr. Obadiah Moyo, Minister of Health, confirmed this morning when we were at the State House that they are making a plan to ensure that these are delivered.
A month later, though.
Yes, unfortunately. But at least they're now coming. But, you know, these things are supposed to be done on a fast track so that we ensure that when a patient comes and they have the symptoms, like what the doctor was saying, they're tested and the doctors and nurses can take the requisite action.
But talking of testing, some believe that the reason why Zimbabwe has low cases that have been confirmed is because we are actually not testing and on the general public. And I actually have people arguing right now saying they're also taking into consideration that in the case of the second death, it was only discovered that now the disease has succumbed to coronavirus after the fact, after they needed attention.
I'll definitely agree with the comments that you read from the viewers that are watching, and I'll definitely say those are the issues. What we saw, for instance, in the United States, when the President Trump was still, you know, not taking it really seriously. There were low counts of the coronavirus, and he was saying this will pass away, this will pass away.
Just like
but
the
when
flu.
it hit, exactly, when it hit,
It
and
really
they started to test more rapidly, you see the numbers will begin to increase. So what then needs to be communicated to people is, in as much as someone might have the virus, if you are tested and you have the virus, it doesn't mean you're going to die.
Oh yeah.
Yes.
Oh, yeah.
So
And
you just need to follow the said procedures. That's why it's important to test. And the doctors stated it at the State House as they were dialoguing with the president and a team from the task force to say, let's expedite the process of testing. When you
testing.
Yes,
Testing, because that's the reason
yeah.
for lockdown. And I understand we've also got something to that effect that we can play for our viewers so that they actually get a front row seat,
Yeah.
a diplomatic passport, as it were, to the information.
We need to have a lot of testing taking place in this country. Why? Because we need to identify where clusters of infections are, so that we can isolate that group and prevent them from spreading it to the next group. We need testing so that we can then direct resources to those communities, those areas, those hospitals, because the requirements of different hospitals at times will be different, so that we do not, with limited resources as we are, have them sitting idle in one area while there's a desperate and crying need in another area. So for that reason, we need to know who is exposed, who has been exposed, who needs care.
My goodness, it is absolutely damning, and the viewers, of course, will decipher that for themselves. This is the doctors; they're really being candid, as you were saying they were, and really, it's a damning place that we find ourselves. But even the doctors, I mean, look, we went to journalism school, and we study almost everything you do. You do business, you do news reporting, you do features reporting. But when you go, you specialize. And if something doesn't pop up, you don't use that skill. And certainly when the world market crashes, you need to dust up your knowledge of business again so that you start talking about it from a position of knowledge, because things change. Yeah. Infrastructure changes, and even mechanisms and mechanization changes. We've got these ventilators, and they're new, they're coming from all over the place. But are people, even our doctors, even equipped well to, for example, operate this new machinery?
Before we get to that, you spoke on issues of change and adapting to new things that will pop up. Dr. Samkange also highlighted to the president that in as much as they will do their best, they express their commitment with the limited resources to say we'll play our part as medical practitioners. He said, give us leeway to constantly change our approach to the fight against the invisible enemy, as the virus has been labeled now. And coming to your point, earlier on in the morning at State House, before the team with Dr. Samkange, the lawyers, and the different other players from different sectors came through, we had doctors who also came through to donate different facilities and services. And one of the trustees to the organization that was actually making this donation was actually highlighting the fact that there's need for training doctors. It's one thing to have a camera, for instance, and it's when technology changes, someone might not be able to use the brand new Mark for a camera, or nowadays you've got jibs and stuff like that. Everything mixed up, technology, so there is dire need for training.
You may be a Spielberg, but because things are changing, you may be the best doctor in the country, but you may not be proficient with a particular new piece of work.
Yeah, and Dr. Samkangi
also spoke to that.
Yeah.
Okay. So let's hear what he had to say.
Beyond making the ventilators, there is the issue of training. A lot of our staff have high qualifications, and our doctors are valued everywhere. Our nurses are even valued even more when they cross borders. But we need to ensure that every one of those nurses and doctors actually is trained on the use of the equipment, particularly if we import from different manufacturers with different utilizations. We need a program of training and preparing our staff for the use of those ventilators, because you don't really want to discover at 1 o'clock that you don't know how this particular machine works and the patient is in crisis.
Wow. He didn't mince his words, of course, saying that the doctors are very valued across the world, including the nurses, but they still need capacitation. They still need to be trained and retrained whenever something of this magnitude comes through, and that's absolutely a valid point, the one we were talking about earlier on. But before I let you go, I know you're a busy man who wants to rush to State House. I think you stay more at State House than the president. He probably comes and says hello because you're always there and hounding him. I see those videos. We actually watch the lives here, and people know Takuzwa now from the field. You tell me, how does it feel? Isn't it overwhelming when you're asking, because these questions about COVID-19 you're asking the difficult questions. Some people just go and possibly want to waffle or hold back with questions, but you're demanding, and we've heard even the Minister of Information single you out quite a number of times. You're quite a thorn in any flesh.
Well, they call us the fourth estate, and it's our duty to ask these difficult questions, because we see people on social media, we meet with people in our families, on WhatsApp groups, you name it. People have issues. When we're interrogating issues and have an audience with these high-placed individuals, be it the president, be it your minister, whoever it is, when you get the audience with them, it's important to ask the question. Yes, it might be intimidating at times, but you just have to gather up all your courage, put your question out there, and get the answers that people want. Because at the end of the day, that's why we are here, to be that, conduit between those in government and the masses on the ground to say
we're now on lockdown. And the masses are really responding. We've got Takumak, who's watching with us, your namesake. We've got Evelyn Tetwa, who's also watching with us, and we would like to say please keep giving us feedback, because we're here for you, and we're going to be giving you all the information that you want to know with regards COVID-19, and the answers that we want you to know with regards COVID-19. Now, I know I was supposed to have let you go a while ago, but there's a question I really want to keep harping on about. In the Western world, a lot of people were stopped from going to hospital when the hospitals were full. We don't have a single person who is currently in the centers we're told will be holding cases of COVID-19. And yet we have people like patient 9 dying, having and being looked after at home when we've got empty beds, we've got room in the inn, as it were. Should you not be asking at least what people are doing at home? Because if we've got space, why are we leaving cases amongst the masses, and why are we leaving our beds empty in crucial holding areas?
Well, I'm not a medical expert, but based on, I'll give you an example of the Prime Minister of the UK, Boris Johnson. When he discovered that he had the virus, they didn't put him at any of the NHS hospitals where he is now, unfortunately, in the ICU. But he started at home. They had space probably there, and as you can see, as you follow developments around the world, they're creating more and more centers where people can actually be admitted. So isolating someone at home is not a problem. But however, are people educated on the issues regards how to handle? For instance, if I am to be, found with the virus, are people at my house able to then practice the steps that are required to ensure that you don't also end up contaminating? Because if you same platforms out there, news platforms, you hear about a daughter who ended up infecting her parents. She isolated at home. They were together.
Yeah.
Unfortunately, the parents ended up in the ICU because of that.
Well, Takuzo, you're headed for State House right now. Please ask that question for me. I'm a taxpayer. I'm paying for empty beds at Wilkins Hospital, and I'm having my countrymen dying at home, and that's not acceptable. And tell them Robert said it's not acceptable. Takuzo Tiamboka there was helping us at least understand what it is like to be on the front line and to be reporting on COVID, breaking new ground. This is something that's never been done before, because this is a virus that we've never encountered before. But all over the world, you were there, you were watching us, and you're a part of us. And now let us look at your feedback, because we've been asking for video feedback. Now let's look at your feedback of how you've been spending lockdown from your various bases around our nation and indeed the globe.
My name is Steve. I'm in Dubai, United Arab Emirates. And during the lockdown, I'm spending my time at home exercising, cooking, and reading. So I just want to encourage you guys to stay home, stay safe. Corona is real.
Hello, my name is Plot Marco, and I'm based in Germany, in Flensburg. That is the northern part of Germany, just at the border of Denmark and Germany. Well, COVID-19 has really affected our lives in a major way. I think for the past 4 weeks, we have literally been stuck inside houses, like not moving, not going anywhere, except when we want to go just to get a bit of fresh air outside, or when we want to go to supermarkets. So a lot of the businesses are closed, except a few essential services that you need. You can still make some payments and buy some stuff online, but literally everything has really stopped, and people have had to reconfigure their lives around the situation. The numbers start to go down a bit because people are taking a lot of precautionary measures to avoid spreading and contracting the virus. So a lot of the times we are inside houses and we only go outside to get a bit of fresh air and take a small walk, but we are not allowed to meet more than one person who is outside of your family. So it has to be within your family, or you meet just one person who is not within part of your family. And I think for me as a content creator, this period has gave me a bit of time to reflect, to appreciate life, but also to look at my work in retrospect and introspect, and look at some of the things that I need to improve.
My name is Nirad Simikentu. I'm currently in North Cyprus. I'm doing my undergraduate engineering degree. It's almost 30 days now since we're on lockdown. We're not allowed to go out unless you want to go to the hospital, market, or to the bank. I spend like 80% of my time in my home, and we're currently doing online lectures. We'll be doing online lectures, so I spend most of my time doing online lectures. And during the weekend, I'll be watching movies, I'll be chatting with friends, I'll be listening to music.
Well, always a great feeling there, seeing what it is that you're doing, and as you make the most of this, which is otherwise a gloomy period for us. We are creatures whom like wild horses like to run unbridled, or our spirit dies. And we're going to go to the diaspora soon to talk to somebody who's been living with the family and has had a torrid time with two of his family members who tested positive for COVID-19. But before we do that, just to go back onto, we're getting your comments and we're getting what it is that you have to say. You say, that's Takumark says, Rob, my guy, loving obviously the information that we're giving you here today. Simba Katsande, we've got Tapua Matare who's watching with us. Thank you, Tapua, for joining us, and indeed everybody else who's watching with us. Tell us where you're watching from And indeed, if you've got questions, Takuzwa has gone to State House. He's going to be asking all the difficult questions. Of course, especially one of the cases that's right at the top is the story of the Bulawayo man. How did we let this happen? It is a tragedy that we should not have let unravel to this point. And so now, as we look at the impact of relations at such a time as this, it's important to interrogate relations amidst people, and especially if a loved one tests positive. And now we've got Love Ngandu, who's joining us today. And Love Mo, welcome to the program from the United Kingdom. There, Love Mo is joining us live from Northamptonshire in the United Kingdom. Love Mo, first, I understand that during the lockdown, some of your family members became sick and tested positive for coronavirus. You mentioned before that your uncle has recovered and is now out of hospital. What about your mother-in-law?
It's very unfortunate. Some of my mother-in-law got affected, and my uncle as well got affected. So they had to be taken into the hospital, but we couldn't visit them. We couldn't do anything to them. Well, the fortunate part is, their phone, so we could only text and, nothing of that sort, that we couldn't even see them, That was the bad part of it. But now at least, they have recovered now. And my uncle is back home, but still we cannot go and see him.
Okay, we had that pre-talk that we had before we went onto this particular Skype, and as I said, you mentioned something about your mother-in-law and the fact that that she had recovered and all that. Is she out of hospital? And your uncle is out of hospital, I am told. But what about your mother-in-law?
Well, she's recovering. Well, my mom, she didn't get serious, so she was advised to stay indoors. She's just recovering at home, but she didn't go into the hospital. It's my uncle who went to the hospital and he was put on oxygen, and fortunately enough he didn't get too much serious, so that he could be put on a ventilator, which we are so much thankful about. Yeah. Okay, so my mom is just my mother-in-law is in the house. She's just recovering from home. She stayed somewhere else.
Oh, okay. So brilliant. It must have been a bit of misinformation. We thought both of them had actually gone into hospital. It's reassuring to know that somebody else was recovering from home. But since you guys were in contact with affected people, were necessary steps taken to make sure that no one else amongst you guys was infected? Because that's a very important thing, right? To stay safe, even though you're in the same environment roughly with people who are infected.
We were just advised to stay home for a minimum of 14 days to just monitor ourselves to see if we were affected, because we were in contact with them like the previous week. But the fortunate thing is we didn't develop any symptoms, so probably we escaped the infection. But the official advice was to just stay indoors and not to have any contact with anyone.
Well, that would mean that you guys had an extraordinary lockdown, because while other people are locking down and at least perhaps can walk the dog in England or take a jog, you guys had an extraordinary and even a stringent lockdown. How has been that lockdown experience for you, and how has it affected your daily routine?
It hasn't affected me much, because I'm considered a key worker or an essential worker, because I'm into logistics. So in the logistics, we have to deliver the essential goods to people. But though it has affected me, because my kids, they are not going to school, and so I have to make sure that I am home, most of the times. And also my wife is a key worker as well. So, because, the life here, sometimes we take advantage of, when the kids go to school, then, we can do our running around. But now, if the kids are at home, it means, I have to be with them as well. So that's basically how it affected me personally in terms of, the child care.
Oh, awesome. Well, Love More, we'll have to love you more another day. Love Mwangandwe there with insights of dealing with COVID positive relations lovingly and without prejudice or unnecessary fear. And I could see in the background there he had Rich Dad, Poor Dad and a book of Richard Branson. Hopefully in the lockdown he was taking more time to make more money and learn how to make more money, because of course a lot of you are taking this time to learn a new trick, learn a new instrument, even do distance learning, online learning, because you can't just sit there. At least learn something, be somebody, and look back and say, in the year when the world stopped working, I learned something new. Now finally today we take a look at a warm and fuzzy story of catching them young. Now a new storybook entitled My Hero Is You, How Kids Can Fight COVID-19, aimed at helping children understand and get to grips with COVID-19, has been produced in collaboration with more than 50 organizations working in the humanitarian sector, including the World Health Organization. The storybook explains how children, their families and friends can protect themselves against coronavirus and how to handle difficult emotions in the face of a new and evolving reality. Now, by the time the book was published, more than 1,700 children, parents, caregivers and teachers from around the world shared how they were coping with the COVID-19 pandemic. Now, the book will be extensively translated, with 6 versions already published today and more than 30 more in the pipeline, in order to reach as many children as possible. Now, before I leave, perhaps goodbye to those people who were supporting us today. Ruziwa Mindurwa, Chenai Mchena, and Takuzwa, who's on his way to State House, has just tuned in and is also watching with us. That's it for today on Diplomatic Passport. Hope you enjoy the Easter holiday and make the most of this unique type of Easter that we all have to endure in our own little corners that we call home. Indeed, we shall leave you an Easter message. We miss you, love you. We'll be back after Easter. And indeed, if there's something that breaks in between, we'll always rush back to make sure you're well informed. I'm Robin Kandiwa. Good evening, stay safe and stay at home and have a great Easter. Love you all.
Fellow Christians, the coronavirus pandemic touches every community. The virus does not discriminate based on religion and particularly threatens the poor and the most vulnerable in our society. Though we are deeply shaken not to physically worship together this Easter, we always have prayer. Our scripture reminds us in 2 Corinthians chapter 4 verse 8, we are pressed on every side but not crushed, perplexed, not despair. Our God is faithful. I call on every Christian to observe the physical distancing measure of more than 1 meter from each other and to avoid congregational gatherings. This is how we protect our families and communities. This Easter from your homes, let us join prayer for God's love and compassion, especially for those at the front line of this health crisis, and to help us face these daily challenges. Now, and as we move into the Holy Week, I call upon all of us to continue washing hands regularly with soap and water, and must keep distance from each other. Let us continue connecting through prayer. God bless you.